Signs for dietary supplementation to prevent cancer and heart disease. First, definition.
Hello, I'm Dr. Leslie Cho, Director of the Women's Cardiovascular Center at the Cleveland Clinic. Every day we get questions from patients about vitamins. So today I wanted to spend some time with you and talk to you about some of the most common questions we get. First are antioxidants, such as vitamin C or E. Vitamin C or E have never been shown in large scientific studies to lower your risk of heart attack, stroke, or death. In fact, taking large doses of vitamin E, 400 international units, may increase your risk of heart failure or death. What about vitamin B6, B12, and folate? There was a recent study of 3,800 patients with heart disease that studied this exact question. They found there was no benefit to taking vitamin B6, B12, or folate for patients with heart disease. We also get questions about herbal medications that lower cholesterol, such as Cuban sugar extract or polycosanol. Cuban sugar extract was studied in JAMA recently, and they found there was no benefit to taking Cuban sugar extract to lower your cholesterol. Now, there are medications which are probably good for you, such as omega-3 fatty acid or fish oil. We advocate eating 2 servings of fish a week. However, if you don't like eating fish, then taking fish oil is a good option. For people who have had heart attack, taking 1 fish oil a day reduces their risk of sudden cardiac death. So taking fish oil or incorporating fish into your diet is a good idea for patients with heart disease. However, fish oil does not lower your bad cholesterol. In very large doses, it can lower your triglyceride level. Things like garlic, grapeseed extract also do not lower your cholesterol. A natural way to lower your cholesterol is to increase your intake of soluble fiber and incorporate flaxseed into your diet. If you have any questions about vitamins or want to talk about preventing heart disease, please give us a call at the Cleveland Clinic's Women's Cardiovascular Center. Thank you.
What is supplements dietary? Dietary supplements are substances that can be used to add nutrients to your diet or to reduce the risk of developing heart problems such as osteoporosis and arthritis. Dietary supplements are available in the forms of pills, capsules, powders, gel, tablets, extracts, or liquids. What is heart disease? Cardiovascular disease is a broad term for problems with the heart and blood vessels. These problems, often due to atherosclerosis, this condition occurs when the fat and cholesterol builds up in the wall of the blood vessels. Applications in medicine. The consumption of appetizers with a high content of fat and salt, or intake of fast food in a rich composition of dietary fat salts, are negatively associated with a higher prevalence of heart disease, principally in the most disadvantaged socioeconomic population. They generally consume this type of food.
A blockage of the arteries can be caused by a blood clot or the formation of plaque from high levels of cholesterol in the blood. Both of these conditions require intensive and sustained treatment to clear the blockage. The number of people who have high blood pressure and bad cholesterol levels is increasing on a daily basis. This is a serious condition that is not easily detectable. However, experts believe it starts with damage or blocking to the inner layer of an artery. So there are numerous reasons why you are experiencing high levels of cholesterol, including too much smoking, heredity, poor diet, lack of exercise, obesity, large waist, and diabetes. However, there is a natural solution which will help you fight these issues. Who can use this remedy? People who cannot afford bypass surgery or can't go for bypass surgery. Prevention of repeated heart attacks. People diagnosed with heart blockage, heart disease. Suffering from constipation, ulcers. People who are looking for weight loss. The following natural mixture will cleanse your arteries, reduce the bad cholesterol levels, and lower the high blood pressure. It contains very powerful and natural ingredients, which are extremely beneficial for better health conditions. So let's see what is waiting for us. Ingredients: ginger juice, 1 cup, 250 milliliters. Garlic puree, 1 cup/250 milliliters. Lemon juice, 1 cup/250 milliliters. Apple cider vinegar, 1 cup/250 milliliters. Organic honey, 2 cups. You can use any cup. Use the same cup to measure all the ingredients. Let's see this powerful and easy method. Firstly, you have to extract the juice from the ingredients. Secondly, take ginger juice, garlic juice, lemon juice, vinegar in a saucepan, and cook on medium heat for 30 minutes, and keep mixing. Thirdly, take it off heat, cool it completely. Finally, add 2 cups of honey, and mix well. Pour this in a clean bottle, and store in fridge. How to drink? Just drink 1 tablespoon of this tonic in an empty stomach at every morning. You can also have 1 tablespoon in afternoon and night. You can store this in fridge for 1 to 2 months. Use clean dry spoons when handling this mixture. Garlic health benefits. Garlic reduces blood pressure, anti-block, reduces cholesterols, antibacterial properties, reduces sugar level, treats skin infection, reduce weight, treats respiratory problems, and many more. Ginger health benefits: preventing and curing heart disease, increase blood flow, reduces weight, increase energy, good for cold, cough, and many more. Lemon health benefits: regulates heartbeat, helps in proper functioning of heart, reduces weight, and many more. Health benefits of apple cider vinegar: remove toxins from body, contains minerals, potassium, vitamins, and enzymes. Health benefits of honey: it reduces cholesterols, fights bacteria, energize body, antioxidants, reduce risk of cancer and heart disease. Thanks for watching, and please subscribe my channel to get
Pros and cons.
Hello, everybody. This is Dr. David Jockers, and today we are talking about the top 7 nutrients to prevent heart disease. We know heart disease is the #1 killer, and it's really related to several different things: chronic inflammation, micronutrient deficiencies. And we're going to dive into that in today's presentation in detail and go over exactly the best lifestyle strategies and key supplements and nutrients to prevent heart disease, or if you're dealing with heart disease, to give yourself the best possibility to heal naturally. And so let's jump into this in detail. If you don't know me, my name is Dr. David Jockers. I'm a doctor of natural medicine. I have a clinic right outside of Atlanta called Exodus Health Center, where I help people overcome chronic disorders on a regular basis. This is my beautiful wife, Angel, my little boys, David and Joshua there. And so as we go into this idea of heart disease, we know, again, it's the #1 killer. So every single year, there's more deaths associated with heart disease than cancer, although cancer has been slowly creeping up on heart disease. And you can see there are medical errors, right, as the 3rd leading cause of death in the United States. What does that mean? That means you go into the hospital and there's errors that are done, or wrongly prescribed medications or medications, side effects to medications, things like that. It's actually the 3rd leading cause of death. Who would have known? And so ultimately, the goal here is to prevent all of these, prevent the need to be in the hospital and to have medications, and of course, prevent heart disease, cancer, and other chronic inflammatory disorders. And so top risk factors for heart disease: chronic inflammation. Heart disease is an inflammatory disease. And so if we're going to overcome heart disease or prevent it, we've got to keep inflammation under control. I'm going to go through that in detail. Poor calcium metabolism. Most people think we need calcium for our bones. We need to take supplemental calcium. Not true. I'm going to go through that in today's presentation. Micronutrient deficiencies, blood sugar imbalances, and chronic stress. We've got to address these things. And so when we look at inflammation, we know that inflammation is a natural process of the body undergoes in order to prevent against some sort of chronic infection. So our ancestors, when they had an injury, typically it was associated with like a flesh wound. So if they had a bruise or whatever, oftentimes it was related to a hemorrhage where they had actual, break in the skin and blood flowing out of their body. And so bacteria and microorganisms could get into the bloodstream, and then they could replicate and create some sort of a chronic infection that would kill us. And so our body adapted and developed this immune process called inflammation, which helps prevent against chronic infections from killing us quickly. But unfortunately, it also can damage other tissue. And our body doesn't know the difference between, basically some sort of an issue where we're eating poor foods causing inflammation, and if we have some sort of a trauma of some type and causing inflammation there, the same response takes place. And the issue is when we have chronic ongoing inflammation, when we've got this chronic vicious cycle of inflammation, it really causes significant problems to the body. And so that's what we've got to keep under control, is this chronic inflammatory cycle. And 8 ways chronic inflammation damages our body. It really, damages all the major tissues. So we know that heart disease is related to inflammation in the endothelial lining. So the internal lining of the blood vessels becomes inflamed and damaged. And when that happens, it ends up throwing calcium. And the calcium basically helps to
Pros. Dietary guidelines continue to recommend strictly the intake of saturated fats. This recommendation flows largely from the observation that saturated fats can raise serum levels of total cholesterol. Cons. Supplementation with vitamin D had no effects in cases of invasive cancer or in relationship with serum vitamin D levels. Issue applied in Ecuador.
8 common diseases associated with vitamin D deficiency. 1. Asthma. While scientists are continuing to work towards discovering the main cause of asthma, recent studies have found a correlation between lower vitamin D levels and its development. Studies have found that optimal vitamin D levels help to reduce inflammation, including that which cause breathing difficulties during an asthmatic attack. Maintaining higher vitamin D levels has been associated with reducing the intensity of asthmatic symptoms. 2. Cancer. Individuals with lower levels of vitamin D levels have been shown to be more prone to all types of cancer, including, but not limited to, breast, prostate, ovarian, colorectal, gastric and esophageal cancers. While higher vitamin D levels will not cure cancer, people who have higher levels are statistically less susceptible to cancer in their lives. Buy highly recommended vitamin D supplement on Amazon. Link in the description box. 3. Cardiovascular disease. During a recent 10-year study looking at the connection between vitamin D deficiency and cardiovascular disease (CVD) in men, it was found that those exhibiting low levels of vitamin D were twice as likely to suffer from a heart attack. A similar study assessing both men and women with no history of CVD showed participants with low vitamin D levels were 95% more likely to experience their first cardiovascular event. 4. Inflammatory bowel disease (IBD). Recent scientific developments have allowed medical professionals to begin to have a better understanding of diseases such as Crohn's disease, ulcerative colitis and other forms of IBD. One connection that has been drawn in recent studies conducted in both Europe and the USA is that between low levels of vitamin D and a higher frequency of these diseases. 5. Depression. The association between lack of exposure to the sun's rays and depressive disorders has been recognized for over 2,000 years. Vitamin D plays an important role in the regulation of several compounds and hormones within the brain, including regulating adrenaline, noradrenaline, and dopamine production. 6. Skeletal disease. While vitamin D itself does not directly impact the bones, it plays a vital part in promoting calcium absorption in the gut and maintaining blood calcium levels. Optimal blood calcium levels are important to ensure normal mineralization of the bones. A study of older adults, aged 50 to 80, found that those with moderate vitamin D deficiency saw a significant increase in knee pain over 5 years and hip pain over 2.5 years. Buy highly recommended vitamin D supplement on Amazon. Link in the description box. 7. Type 2 diabetes. Recent research has shown that individuals with higher vitamin D levels exhibit a 43% reduced risk of developing type 2 diabetes compared to those with lower vitamin D levels. These studies are unable to find a difference between maintaining optimal vitamin D levels through supplementation or regular exposure to sunlight. 8. Dental cavities. New studies have shown that individuals exhibiting vitamin D deficiencies exhibit a higher instance of dental cavities. A recent study concluded that children found a 47% reduced risk of cavities when they maintained optimal vitamin D levels. We really hope you find this video helpful and don't forget to share it with.
Conclusion. The main conclusion at the present is that there is no justification for the strategy of dietary supplementation with omega-3 fatty acids or with vitamin in the prevent of cardiovascular events or cancer.
Hi everyone, this is Dr. Rusho. Let's discuss if supplementing with vitamin D can decrease the incidence or your chances of cancer or cardiovascular disease. Now, we've all probably heard something about the health benefits of vitamin D supplementation, and there is evidence to support, yes, that supplementing with vitamin D can improve your health. However, it does appear that the health benefits of vitamin D supplementation have been over-exaggerated, and this study actually helps kind of reinforce that conclusion, which is essentially that vitamin D supplementation may not lead to all the benefits that you've been told that it will. Now, I'll put this study up here on the screen. This is a large study entitled Vitamin D Supplementation and Prevention of Cancer and Cardiovascular Disease. They tracked over 25,000 patients for a number of years, looking at the incidence of cancers and cardiovascular disease over time in those supplementing with vitamin D compared to placebo. So this is a placebo-controlled trial. People were randomly assigned to either take vitamin D supplementation and tracked or placebo and tracked. So this is very high quality data. It's not your typical kind of association or observational data, which we see in much of the vitamin D research. And their conclusion, to quote, supplementation with vitamin D did not result in a lower incidence of invasive cancer or cardiovascular events than placebo. So in summary, vitamin D supplementation does not appear to decrease cancers or cardiovascular disease. However, there is one important clarification I should make here, which is sun exposure has been very tightly, or I should say somewhat tightly correlated with reducing both cancers, most types of cancers, and cardiovascular disease. So sun exposure may vector the benefit that vitamin D has been purported to garner. So if you're trying to optimize your health, if you're trying to reduce or mitigate the risk of cardiovascular and or cancer incidence, then maintaining a healthy level of sun exposure is an excellent practice toward that endpoint. And I'll link here to a couple interviews we've conducted with vitamin D researchers that also provides guidelines. But essentially, getting into the sun for at least 15 minutes a few days a week without protection is a great place to start. So 2 to 3 days per week, at least 15 minutes, middle of the day, direct sun exposure, no sunblock, exposing as much of your body as you can. The darker your skin is, the more exposure you may need. So that 15 minutes, that 10 to 15 minutes may need to be more from anywhere from perhaps 15 to 25 minutes. However, it's certainly something that has been shown to have a number of health benefits, that is sun exposure. And if you're looking for more specific dosing guidelines, in my book, Healthy Gut, Healthy You, I lay out very specific guidelines depending on if you're vitamin D sufficient or vitamin D insufficient, meaning if you've had a blood test and your levels are low compared to normal, how much vitamin D you need to maintain the normal or to bring the low up into the normal range. So in summary, vitamin D supplementation, at least to what I feel to be the best study to date, does not prevent cancer and cardiovascular disease. That's with supplementation. However, there is an impressive amount of literature showing that regular, safe sun exposure, not burning, but getting regular sun exposure, does protect you against multiple forms of cancers and cardiovascular disease. So this is Dr. Risho, and I have this information to help you get healthy and get back to your life. Thanks.